Despite growing public awareness, elderly residents of nursing facilities face a high risk of developing bed sores. Also known as pressure injuries, bed sores pose serious health risks for the elderly. According to the CDC reports, approximately 11% of nursing home residents experience bed sores. Bed sores are caused by prolonged pressure on the skin and most commonly occur when patients remain in the same position for too long. The pressure restricts blood flow and ends up resulting in tissue death. Bed sores are categorized in 4 stages of severity. Stage 1 is the first and least severe stage and can occur in a matter of hours. A Stage 1 bed sore appears as an area of discoloration on unbroken skin. It will look red in light-skinned patients and blue or purple in dark-skinned patients. The area may feel warm to the touch, but could feel cooler than the surrounding skin. The patient may complain of pain, itching, or a burning sensation. There are several ways that continued pressure on the skin can lead to bed sores. When the skin is pressed for a long time, usually from the weight or force of the patient lying or sitting on the affected area, blood flow is restricted and the tissue starts to die. When sheets, clothing, or other material constantly rub on the area of the skin, the friction damages the tissue. When the bone is pulled in one direction and the skin in another, shearing occurs. It's most common when the bed is inclined, causing the patient to slide downward while the skin remains in place. Prolonged exposure to moisture from sweat, urine, or fecal matter breaks down the tissue in the skin. Although bed sores can occur anywhere on the skin, Stage 1 bed sores more often appear on the bony areas of the body. Residents may develop bed sores on the shoulder blades and areas around the tailbone, but patients in wheelchairs may specifically develop them on the backs of the arms and legs and areas around the spine. Bedridden patients may also develop bed sores on their heels, ankles, the back of their knees, their hips, and the back or sides of the head. An individual of any age can develop bed sores, but the elderly are most at risk. They tend to have thinner skin that's more vulnerable to damage. They're also more likely to have conditions such as immobility, injuries that cause lack of sensation, urinary or fecal incontinence, poor circulation, and poor nutrition and hydration that can all increase the risk of developing bed sores. Untreated bed sores don't go away on their own. In fact, without treatment, bed sores worsen and become more serious, even potentially life-threatening. That's why all bed sores require immediate medical evaluation followed by treatment. If treated in the early stages before complications develop, Stage 1 bed sores can heal in a matter of days. However, patients with wound healing impairments, such as diabetes, may experience slower healing or a progression to the later stages, even with treatment. If the skin is broken, the wound becomes a Stage 2 bed sore. This stage is often more painful and requires greater care to prevent infection. If left untreated, bed sores may progress to later, worse stages and can result in broken skin, infections of the skin, muscles, or bone, and even cancer. Bed sores are 100% preventable, and there's no excuse for nursing homes to allow their residents to develop these painful, dangerous wounds. The formation of a bed sore is almost always a signal of neglect, and elderly patients deserve better. If you suspect someone in a nursing home is the victim of neglect or abuse, you can help stop it by reporting your suspicions to local police, Adult Protective Services, or the ombudsman in the nursing facility. They are all required to investigate every allegation of abuse. Many will follow up with you, especially if the victim is your family member. If an emergency is occurring, please call 911. Adult Protective Services often include the police in their investigation when criminal abuse is alleged. You can learn how to reach Adult Protective Services in your state by visiting the state directory of the National Center on Elder Abuses. Your loved one's nursing home should be a safe, pleasant environment where they enjoy a high quality of life. Take these steps to ensure your loved one receives the care and treatment they deserve. Use Medicare's Nursing Home Compare tool to view detailed nursing home ratings. Visit the National Elder Care Locator, a federal government program designed to help you locate senior services in your area. Be aware of the signs of elder abuse and report any suspected abuse to the appropriate authorities. Contact a nursing home abuse lawyer as soon as possible after confirming abuse or neglect so the nursing home can be held accountable. If you believe a family member suffers from a Stage 1 bed sore at a nursing home facility or was injured in a nursing home due to elder abuse, maltreatment, or neglect, contact us for a free case evaluation. A lawyer may be able to help prove that a nursing care facility is responsible for bedsores. Our team of legal experts is happy to hear your concerns. nursinghomeabuse.org, exposing nursing home abuse and helping seniors get justice.